Shaheda Omar from the Teddy Bear Clinic. A very good evening to you, and thank you so much for joining us once again, Dr. Omar. I want to talk about that case in Durban that we saw earlier on. I mean, I think quite a lot of people would have been surprised that then the parents were said to be involved in, this all coming to a head when the complaint had been the child had been terrorizing children at the school, including teachers. What do we read into this situation without being too speculative?
So I think the child that is terrorizing is certainly crying out for help. This maladaptive behavior, underlying behaviors, there's usually feelings, and underlying feelings, there are reasons explaining why children behave in the way they do. We cannot condone or justify that behavior. However, one actually needs to listen, put ears to the ground and see what is it that the child is actually crying out for, because it's a maladaptive behavioral response. It's a way that the child finds best. The child doesn't know any better, and the child's asking.
Okay, so when you say maladaptive, in layman's terms, what exactly are you saying? What are we to understand?
Well, the child is victimizing other people, bullying, exerting power and aggression, trying to assume some sense of power and control in his life, where he feels probably powerless, helpless, defenseless, and this is his way of coping and dealing with his own unresolved issues.
I mean, when sometimes people have precocity in a child, especially from a sexual perspective, they always say it's because that child would have seen, gleaned that behavior, or being acted upon them. So is this what we're saying here as well?
That could be a contributing factor. I think one cannot dismiss or discount the fact that the child may have been a victim of domestic violence, being a victim himself of physical abuse, emotional abuse, whatever other things that he may have been exposed to, just being exposed to being in a cultural of violence. I think those are things that one needs to factor, and that could certainly contribute to the child's behavior.
So in this case, we're talking about a 19-year-old. Are we then to assume that this has been ongoing behavior that has not been nipped in the bud in time and has therefore been left to fester and become worse?
So this appears to be the case because it seems to be a pattern of behavior. There seems to be chronicity, meaning it's occurred over a long period of time where this behavior has not been disrupted, it hasn't been dealt with, and it hasn't been responded with proper interventions and appropriate measures being put in place where actions have consequences, and that the impulse control issues have not been addressed. So that's probably what we are seeing playing out here.
And I'm just wondering, if we talk about impulse control, as we spoke about the culture, the environment, the ecosystemic behavior that a child has been exposed to, that obviously extends to the community within the child is, and perhaps sometimes in the school environment. How young is too young for a child to start being a bully? For one to say these are some serious red flags, even if you don't know the child young enough,
So how young is young?
Yeah.
We can see our 2.5-year-olds pushing out the children, pulling, grabbing them, and where do they actually learn their behavior from? We know behavior is rooted in learning theory, observational theory, and what children see around themselves, what they witness, what they're exposed to, they become socialized into that kind of behavior, and it becomes normalized into their responses and repertoire.
Now, I want to look at where one would say then the balances of power should be tipped against the child, but we're seeing a rising phenomenon of children, of students bullying teachers. What gives rise to this, and is it more embarrassing for a teacher to then report it, to say, I am being bullied by obviously somebody who's younger than you, whom I should have more power and authority over? So
I think if we look at learners who assert themselves in this aggressive manner towards educators, teachers, one needs to also contextualize that. Often it comes from a place of feeling out of control, feeling helpless, feeling desperate, and the only way they feel that they could be heard or responded to is by being aggressive and violating the educator. So that is something that one needs to factor into this whole space. But as far as educators are concerned, we've actually dealt and we've done SNAP surveys with educators where many of them actually feel a sense of humiliation, shame, and even stigma of coming forward and saying that I've been violated by a learner. Because of their feeling helpless and hopeless and powerless, they often feel defenseless because they feel they are going to be subjected to further torment and violation once they leave the school premises. So teachers are not always willing to come forward for fear of their own safety.
And I'm just wondering, and I'll be careful in using the term new regarding this phenomenon or paradigm shift, but certainly if one goes back even 20, 30 years ago, it wasn't at this level, and the kind of attacks on teachers weren't also as brutal. Is there enough research on this phenomenon? This is what I'm wondering, for us to be able as a nation to, aptly deal with it. So
absolutely not. There isn't sufficient research done on this, but just looking back at the past 20, 30 years, it's certainly increased in the incidence of violence directed at the educators, where it's become more normalized, where learners, it feels as if they feel they can do as they please, because I think the measures, the protective measures and the mechanisms to curb this spate of violence has not been adequately dealt with. And that is something that the educational sector and educational institutions need to work on. We talk about discipline, we talk about positive parenting programs, but we also need to look at positive educators programs on how educators need to respond to crisis situations, to risky situations, to challenging learners on managing them effectively.
Now, I want to talk about indirect bullying. That's also something that we don't speak enough about, because I don't think we know enough about it. And then we'll also talk about what the overall impact of this is on us as a society, because we spoke about earlier on children saying they don't want to go to school. Obviously, parents are affected. They also get anxiety, depression. But let's just start with the indirect bullying and then also talk about the general consequences of bullying.
So indirect bullying is something that's not always overt and visible to the naked eye. It's not something that a parent or a caregiver is easily able to identify, but it's something that the child would experience: name calling, taking the child's lunch away, or ignoring the child, where they would form groups together and the child would certainly be overlooked or glossed over, and even the gentle push or shove, which is quite subtle and would not be easily noticed by other people. So that is something that could be very traumatic for a child, but it's not overt enough or tangible for somebody to say this child is a victim of bullying. But I think the underlying symptoms that often are seen, where a child withdraws, the child becomes refuses to go to school, becomes disruptive, having sleeping disturbances, eating disturbances, and also withdrawn behavior or grades plummeting at school. So those are some of the symptoms that should alert parents. They should look out for those red flags, because children don't always share what they're experiencing, or they don't have the vocabulary to articulate that they are victims of bullies.
Thank you very much for speaking with us and sharing your insights. It's an ongoing problem that we, of course, as a nation should continue to discuss, including ways of how to prevent further bullying. Childline certainly has some very good tips. Go onto their website and see. Dr. Shaheda Omar is from the Teddy Bear Clinic. We're going to take a quick break. Don't go away.